Welcome to this press conference to have an overview of the Quebec coronavirus situation in Quebec. The Premier of Quebec, Mr. François Legault, is as usual with the Minister of Health and Social Services, Ms. Danielle McCann, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier. Hello, everyone. Listen, we're going to start with the numbers of the day. We unfortunately have 52 new deaths, a total of 487 deaths. I wish to offer my condolences to the families and loved ones of those victims. We have now 14,800 cases that are confirmed, an increase of 612. We have 984 people who are being hospitalized. That is an increase of 48. And we have 218 people in ICU. That is a decrease of 12. Of course, we continue following the situation very closely in CHSLDs. We continue asking each CHSLD how many people they need. And of course, we try to send the maximum amount of reinforcements that we can to CHSLDs. And I'd like to repeat, as I was saying yesterday, that on top of the shortage that we had before the crisis, there's a lot of people who aren't at their work, either because they are infected or their health condition doesn't allow them to take those risks, or sometimes also people who are scared of catching COVID-19. So today we are at 1,382 absences just in public CHSLDs. I think it's important. Perhaps it wasn't clear yesterday. I'm only talking here about public CHSLDs. So if we add private CHSLDs to that, and if we also take into account the situation that is exceptional and that we are experiencing right now, we can say that we are missing about 2,000 people in CHSLDs. And today I wish to perhaps send an even clearer message to our doctors, whether they be specialists or family doctors. This morning on Paul Arcan, I heard the president of the Union of Family Doctors as well as the president of the Union of Specialist Doctors say, well, there's no shortage of doctors in CHSLDs. There's a shortage of nurses and of orderlies. Yes, that's absolutely true. The problem that we have right now is that we don't have 2,000 available orderlies and nurses who can go and work tomorrow morning in CHSLDs. We can't do any kind of magic trick. We can't pull these people out of a hat. And that is why, for a few days, and I don't wish to insult doctors, but what I'm asking of doctors is to help in CHSLDs. I understand that there's no doctors missing, but they can come do the work that nurses normally do. Perhaps we can ask the nurses to do the work of the orderlies. What we're missing is people. We're missing hands. And we have doctors who have training as general doctors in general medicine. I understand that they are overqualified to do nursing work in CHSLDs, except that since we don't have anybody else to do that work, we are asking doctors, both specialists and family doctors, to come and help out in CHSLDs. So it's important to do that. I understand that right now there's a lot of family doctors who are working from home. There's some as well who are in CHSLDs, but we need more to come and help out the nurses and the orderlies. And on the specialist doctors front, I heard the president of the union this morning who was saying, we have anesthesiasts, we have a lot of people who are not doing anything right now, since surgeries have been delayed by a lot. Well, what I'm asking specialist doctors is to come in our CHSLDs to help out with the giving of care, with the helping of feeding the residents, with the helping of in washing them, in caring for them, help out the nurses. I think that it's important. They have the skills. I understand that it might not be all that much fun to ask specialists to come and care for patients instead of the nurses, but we have a dearth of nurses and orderlies. And I heard the president of the union, Ms. Francoeur, say this morning, well, we can't ask specialist doctors to wash floors. We're not asking them to wash floors. What we're asking them is to help out the nurses who will be able to help out the orderlies, who will be able to help out to make sure that everything is clean and that everything is washed. But we have that need, and I, today, wish to call out to people's sense of duty, to people's sense of responsibility. We have 20,000 doctors in Quebec. Can we ask them, especially I'm thinking about the specialists here who have less work since we've, postponed the surgeries. Can we find 2,000 out of that group that could, for a few weeks, temporarily, come and help out in CHSLDs? You have the skills. The choices that we have is to send people who are not qualified at all to go and do nursing or orderly work. And I'm thinking we have doctors, including the specialists, who have the skills, who have the knowledge, the basic knowledge, in order to come and help out with our elderly. So I'm asking for a special effort to come in our CHSLDs to take care of our elderly. We need you. I don't know how to ask for it anymore. It's been 3 days that I've been asking doctors. But we need you in CHSLDs in order to do all sorts of work, including work that is usually done by nurses. I would like to end by saying, yes, for a few days we've been talking a lot about CHSLDs and problems in certain residences, but let's not forget to continue respecting the guidelines in our homes and in the rest of our lives, generally speaking. The fact that we've respected the guidelines in the past few weeks, it has already allowed to save hundreds of lives in Quebec. So now is not the time to stop and to slacken the guidelines outside of CHSLDs, in our homes and the rest of society. We are getting through this. Yes, we're caring very particularly of CHSLDs, but it is important to continue following the guidelines. And I just want to tell Quebecers that things are stabilizing in hospitals, and we will, get through all of this, and we'll be able to face the beautiful days.
We continue to follow very closely the situation in senior residences, but we're still lacking personnel. Today, I'm asking every available physician, generalist or specialist, to come and help us. We need you to do the basic work. I appeal to your sense of duty to help us take care of the elderly. To the rest of the population, the situation will get better. Courage, everyone. Good days will return. Thank you all.
Merci. Alors, pour la période des questions en français, nous
Thank you. We are now going to start with the French questions. Hello to all three of you. Concerning the doctors, we feel a little bit of impatience here. Is the fact that you didn't get the response that you wished for could be linked to the fact that there's no signed agreement on the remuneration of specialists, and that's been a few weeks? And a question that I've already asked in the past, a specialist that does the task of an orderly in a CHSLD is going to be paid how much to do that? Well, listen, I think that the questions of remuneration, we're going to fix them to everybody's satisfaction. But what I've understood from the interviews of the two union presidents this morning is we're saying, hey, the Premier is asking us to go to CHSLDs, but there's no doctors missing in CHSLDs. We agree with that. We have a scarcity of nurses and orderlies, and doctors have training. They could help us do that work. Maybe I'm the one who wasn't clear enough in the past few days, and I hope that today I've been very clear. We need ideally 2,000 doctors, whether they be generalists or specialists, who come and care for people, who come and wash the patients, who come and nourish, feed the patients, who come and do the work that is usually done by nurses. So we'll find the means of paying them. I think that they shouldn't worry about that. No, absolutely not. And I think that I can confirm that the agreement was signed last evening. It was just signed with the specialists, so there's no problem on that front. And what I would say on that, to add to what the Premier said, is that we are aware of a lot of doctors, generalists, specialists, who go and do humanitarian missions outside of Quebec, in Africa, in many countries. They go and help out. They devote themselves a lot. Well, what I'm telling those people today, what we are saying today, is that the humanitarian mission is in Quebec right now. It is in the CHSLDs, and we would want for our doctors to come as a humanitarian mission in the CHSLDs for our elderly, those who built Quebec. A question concerning the reagents. We got information saying that the number of tests greatly decreased in the past few days because of a lack of reagents in Quebec. I would like to have information on that. Where are we at? I'll give you the exact number. Reagents. Yes, in fact, we have for 3 days' worth. But as I was explaining, we are discussing right now with Winnipeg, who got the recipe from a French company. And we are going to be able to create the reagent ourselves, so I do not think that there will be problems. So it's not a reason that would explain why there's fewer tests. I think that we are concentrating in testing a lot of people, you know, the staff and residents in CHSLD, so perhaps we've displaced the places where the tests are made, and perhaps that's why there's fewer or a different number. But we continue having thousands of tests every day. Yes, and it stayed at a usual level. We were at 6,000 some yesterday. So we continue, you know, with that pace as far as the analyses are concerned. And from what I recall, we have at least 14,000 tests per million inhabitants. We are one of the places in the world where we've tested the most. I would like to be sure that I've understood correctly the question of the lack of staff, because there were a lot of people who signaled their interest on Je Contribue, and I've been told that there are people who are normally do home care who wanted to be volunteer who haven't been called, and the federal minister of health said that they had a bank with, I think, 1,000 names of people who speak French who would be ready to help out in Quebec. So we hear echoes of people who say that they're ready to come and help, but on the other hand, you're telling us that there is a problem visibly still. So how is it that we're having such a difficulty bringing all these people who actually want to help and who visibly can't do it? Well, yes, in fact, we have been able to get a few people here and there, either that they hadn't quite finished their training or they were retired, and now through the Je Contribue website, they are now available. And this is something that we continue looking at, you know, those who give home in enterprises of social economy. We're looking at all of that, but now we need 2,000 people, and we're thinking, amongst others, that in specialists there's at least 2,000 who right now, because of the surgeries being postponed, would be available to come and fix the problem quickly, which will give us time to set up the rest. Concerning the federal government, we did in fact ask them how many qualified people there are, because we also don't want to bring people who are not qualified. And I just saw at the same time as you a few minutes ago on Twitter, the minister is saying we may have 1,000 qualified people to send. So if that is the case, they would be welcome. So we asked the federal government how many they could send us, you know, how many qualified people who could help out in CHSLDs to give a hand. And of course, they would be welcome. And I also want to make sure that I've understood correctly what you said. You're talking about generalists and also specialists. Are we to understand that right now there's a kind of like fight between doctors that makes it that we can't get people in the field? And you were talking about an agreement. Do we have any details on what that agreement holds? Well, this morning I was listening to the two union presidents for the family doctors. He was saying all family doctors that we need in CHSLDs, we've sent. But there's a lack of nurses and orderlies. And then the president of the specialist union said, well, we specialists are ready to replace family doctors, but for the time being, there's enough family doctors. That's not at all what we were saying. We're asking as much the specialists as family doctors to come and help us out to do nursing work because we can't find enough nurses. I understand that they're overqualified to do that work. But I mean, it's not true, as the president says, that we want them to clean or to mop floors. We just want to have extra hands. But people who do have basic training, and I think that specialists and family doctors do have that training where they can do what a nurse usually does. But we don't have enough nurses, so maybe that's where we didn't understand properly. Anyway, I'm a guy who usually speaks clearly, but maybe I haven't been clear enough in the past few days. I think Ms. McCann wanted to add something to the last part. Well, we have an agreement with the specialists, and we also have an agreement with generalists. So those agreements have adapted remuneration scales in the context of COVID-19 within their own envelope. It's not additional payouts. It is a payout that is adjusted within the FMSQ. Thank you. Next question.
Bonjour, Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Justement, sur cette rémunération-là.
On that remuneration, because I just want to, I think that it's going to go with the questions that my colleagues also have. You're asking those doctors to go into CHSLDs, do the work that is usually done by nurses and orderlies, etc. Could it happen that those people make wages that is way too high compared to the task? I mean, a nurse, for example, who makes a certain amount of money, and right now as a specialist doctor doing the same work as she and makes 15 times more money, is that what that means? Is that the kind of payout that there will be for specialist doctors who are going to go and to work in CHSLDs? Well, first, the envelope that is planned for specialists and doctors should be spent. No more, no less. Now, are we asking certain specialists to go and do nursing work and to be paid more than a nurse while they do the work of a nurse? Well, yeah, because there's a national emergency. And the national emergency is that we're missing. We have a scarcity of nurses and orderlies in CHSLDs, and I prefer having doctors who come and do nursing work in CHSLDs rather than having specialists who are at the hospitals in front of empty beds because we've postponed surgeries. I understand that we're not going to be able to postpone them indefinitely, but perhaps, since maybe we can postpone them for another few weeks, so that we can fix this national emergency that we're experiencing in CHSLDs right now. My other question, it was talked about in the press conference with Mr. Trudeau this morning. Mr. Trudeau said that they were discussing with you about the Army. The Canadian Armed Forces have medical staff. They have nurses who are qualified. They also have doctors who are qualified who could do emergency work. That is their mode of work. They intervene in emergency situations. Have you requested that military nurses and doctors intervene? What I asked is how many they could send us, people from the armed forces that have qualifications in health. And up until a few minutes ago, I didn't have the answer. Now, I just saw on Twitter that there might be 1,000. So much the better. But what we asked is, do you have Army staff that is qualified that could come do the work, for example, of nurses in our CHSLDs? That is what we asked. And we are open to receiving qualified staff that come from the Canadian Armed Forces to go help out in CHSLDs. Thank you.
Québec, Journal de Montréal.
Oui, bonjour à tous. Monsieur Legault,
Mr. Legault, you've been saying that we have a very serious scarcity of resources in CHSLDs. You've said it. After the crisis, are you planning on increasing the number of orderlies and nurses in those residences to create minimum ratios to ensure the quality of life? As I've already explained, yes, we're going to have major reform. That reform is going to start by negotiations on remuneration, because now we have two problems. One is the payments. It's not enough of an incentive for there to be enough orderlies. And secondly, because there's not enough orderlies, the work becomes a lot more arduous for those who are there. So even less attractive because of that scarcity. So everything starts by first increasing wages. I understood in reading certain tweets sent by Dr. Barrette that he tried in 2015 to bargain that with the unions and didn't succeed. Well, I want to succeed in bargaining with the unions so that we increase the wages of orderlies more, particularly in CHSLDs, than other employee groups. But it's not simple. Mr. Barrette told us that he tried in 2015 and didn't succeed. We hope to succeed in the present bargaining. My question had to do more with the number of orderlies per patient and the number of nurses per patient as well. So could you create ratios, minimum ratios, to ensure a minimum quality of care? I'm coming back to my dear friend Dr. Barrette, who says that in 2015, when he tried to negotiate the ratios, it would have cost $1.2 billion. So I'm sure that there is some bargaining to be had on ratios, but let's start by just fill all the positions that are posted. There would already be quite an improvement. Should we go higher? Well, that's not excluded. The remuneration of doctors is something that is quite complex to both explain and understand when one is not from that domain. According to the agreement, how much will specialists be paid, the ones that are going to come and help out in CHSLDs to do the work of nurses, but also how is it that today you practically have to go on your knees to beg them to come back in the network? Don't you have powers because of the this national emergencies that would allow you to assign tasks to doctors? Well, first, without talking about the entire genesis of the remuneration of doctors, remember that we compared to the rest of Canada, we have a gap of about 10%. That means that our specialists, as much as our generalists, make 10% less than in the rest of Canada, on average. So that remuneration is okay. Now we're asking them something special, to come and do tasks that they don't usually do. But the remuneration that is planned for is going to be given. We are the ones who are asking us exceptionally for a few weeks to come and carry out exceptional tasks in CHSLDs. And listen, without giving all details, because I don't have all the details in mind, but to give you a general overview, for example, the remuneration per act, that's what is the case. Well, in the context of COVID-19, we also have a modality of groupings, that would be better adapted in a context of CHSLD, where they would come and work in a context of COVID-19. The other thing is that doctors, generally speaking, and that is for the FMQ and the FMSQ, were not paid out in the past to do acts over the phone or by teleconsultation, so now they will be paid for that. So that is another important aspect of those agreements. On another topic, the orderlies and attendants, sometimes they are refused jobs if they have, criminal record. And now we're learning that the person who was in charge of Heron CHSLD created a roadmap to something to do with fraud. I don't know where to start, but first, are you having an investigation to know whether there's other similar cases in other private CHSLDs in Quebec? Is it acceptable? No, it's not acceptable. And I asked that that information that came out be reviewed, but it's not acceptable, as you say. We make sure that the employees don't have a criminal record, but perhaps it was accepted that managers and owners of CHSLDs have a criminal record. So I ask that all of this be reviewed. But it isn't acceptable. Thank you.
Madame, Monsieur le Premier Ministre, actuellement,
Right now, according to the information that I have, there would be 900 available nurses in family medicine groups that have not been deployed. Why not? Well, family medicine groups still have activities going on. They are open for 12 hours throughout Quebec. And we also have evaluation clinics as well that we've deployed. And these are specifically for people who have flu symptoms or flu-like symptoms, that can be of any kind. And so there are nurses in those clinics. So those nurses have been deployed in those clinics, amongst other places. You're saying, Mr. Premier, that certain surgeries may have to be postponed. What we're hearing right now is that we have 30,000 cancelled surgeries. If we make it to Saint-Jean-Baptiste, it'll be many more. Might we not have another crisis of another kind in the fall because there's going to be too many surgeries and that the system won't be able to carry them out and perform them? Of course, I always go back to my balance of inconveniences. It is true that if we ask a certain number of specialists to come for a few weeks to help out and lend a hand in CHSLDs, that means that certain surgeries will be postponed. But there has to be some means to find a balance. Right now, we have 6,000 beds that were available. We need 1,000. So there is a way to find some kind of balance where certain doctors could start doing surgeries possibly, but right now there's an emergency. There's a national emergency. We need specialists in CHLDs until we have control of the situation again. And on top of the emergency, if I may add, let's also recall that we're very tight as far as the medication is concerned, the medication that is required for surgeries. All the medication having to do with sedation, for example. So we had to be very prudent. You know, when we start with elective surgeries, of course, the urgent and semi-urgent, the urgent surgeries are performed, and the semi-urgents we've gone forward in the past few days. But we have to be careful with the medication right now. Bringing the resources of home care in CHSLDs, is that not risky, taking into account there's already 26 or 27% of deaths that are in homes? Aren't we just going to move the problem around? We're not placing it or moving it. Home care is ensured. They have to be maintained and they have to be preserved, home care, for those people who are at home. And I think, I met somebody yesterday who was the daughter of a person who receives her care at home and who was so happy with it because it allows them to stay at home. So they were very grateful for it. So what we've done is we've decreased certain non-essential services. For example, cleaning help. So apart from that, the services to be able to help people at home are maintained and are going to be maintained. They're crucial. What we're saying is that the social economy enterprises that were a lot used to give to be able to assist in homes, those resources now are available because they used to do a lot more cleaning work. And in a very accelerated work, we are doing something with those groups, the ESAD, because we have hundreds of people who would be available to come and help us for basic care in CHSLDs. So we're not touching, the home care services. On the economy front, Mr. Legault, you talked about, injustices, the little stores that have to close, whereas Walmart and Costco continue selling non-essential products. Is it considered, or is it being considered, to prevent the large chains to sell non-essential products? How is that going to be able to be balanced out? What we're looking at with public health is rather the opposite, that is to allow small businesses to start being able to sell their products again, particularly the small ones that are faced by unfair practices because of the big box stores. So with Dr. Arruda, we're setting up guidelines so that, for example, the 2-meter distance be respected. But we are looking at being able to reopen those stores soon. I'm going to start with a question from a colleague. You said yesterday that all 2,600 residences were inspected. How many inspections and what kind of inspections were made last year in the residences for the elderly? I don't know. Well, what I can tell you is that you saw the chart of the residences that have priorities, you know, the red, the orange, the yellow, if I could say it like that, that's on the side. Those residents were inspected, and the 2,600, we're in the process, an accelerated process right now. We're already acting throughout all regions of Quebec to be able to inspect them. So that is being done as we speak. But the ones that you have on the chart, which are the ones that are under surveillance, more or less, because those that are, of course, in red are very monitored, they're all inspected. And last year, my colleague, Ms. Blais, the minister responsible for the elderly and caregivers, asked to increase the number of inspectors that went to CHSLDs, and that was done by the minister responsible for the elderly and caregivers. That was done last year. And there were more visits on the part of inspectors in CHSLDs thanks to that decision taken last year. Mr. Premier, Quebecers heard your call to doctors. That seems to be a call of desperation because you're saying you don't know how to word it anymore. And you just said that you're trying to take control over the situation. So the situation right now is out of control in CHSLDs in Quebec? Well, I would say, and I repeated it often, in the vast majority of residences, it's under control. There are a certain number of them, and you got the list according to the degree of problems, red, orange, and yellow, where there is a scarcity of staff, and that's what explains the loss of control, because there was already staff missing. With the people who got infected with COVID-19, we had to have additional procedures, hot zone, cold zone, ensure that the staff does not go from one zone to another, you know, from a hot zone to a cold zone, etc. So it requires even more staff. So yes, there is work to be done in order to be able to have all the necessary staff in CHSLDs, in particular those of which you have a list. 2 or 3 additional questions can be taken. Mr. Premier and Ms. McCann, perhaps you'll be able to answer. Hot zones and cold zones, to my knowledge, Hotel Dieu is going to be transformed into a COVID hospital. Is that correct? How will that work? Hot zones and cold zones. And do you have enough staff to avoid a transmission? That is, that people go from one section to another and contaminate. Yes, well, look, I can tell you that throughout Quebec, I saw about 20 sites that we call non-traditional sites, a little bit like Hotel Dieu. The site's not yet open, but Hotel Dieu is not yet open, but I think that we'll manage to open it because I think there's a true need, but it's a need of staffing that we have. And often in these non-traditional sites, we bring people who are either not affected by COVID-19 with the adequate staff, or we have a lukewarm zone where we have people who were in contact or who just came back from the hospital but who cannot go in the CHSLD, and we're going to put them in a lukewarm zone for a period of 14 days to make sure that everything is okay. Of course, the issue, and here too we've had discussions with Dr. Francaire, and we could open more traditional sites like the Hotel Dieu that we would like to open with the help of specialists. That is an objective that we have together with the Federation of Specialists, of course. And what I want to tell you as well is, as the Premier said, there are places where it's more difficult. We know, for example, that in Montreal and the Greater Montreal region, Laval, Montérégie, and La Mauricie as well, we have staffing issues that are more serious, and that is where we're going to have to put as much effort as possible to be able to fix the situation. Dr. Arruda, the 7th of April last year, your colleague, Dr. Massé, said that there were modelings being prepared with expert colleagues from public health, and we also understand from the INES as well, and that is what is going to be able to tell us about the behavior of the virus, the incubation period. Where are we at with that work, and when do you think you'll be able to present results to us? I have a presentation by the experts tonight as such. I got a preliminary report, and we have questions to ask them. So there's that review, but there's also all sorts of new articles. One is in Science today. They're trying to predict how the behavior is going to behave. Are we going to have a virus like SARS, SARS-1, which just kind of like fizzled out, but people think that it's going to be like other coronaviruses, like, colds, but that are going to persist over time, and who are worried about the second potential wave. So we have to be able to look at those elements. So yes, there is that element that will be presented to us, and we're also looking at what is being done everywhere in the world with everybody else's experience, because that does have an important impact, particularly knowing at what speed we're going to be able to turn the light back on with a dimmer and to see, the potential of mass immunity population. Are we at 10, 15, 40% of affected population? Those are all things that we have to look at for the future. Mr. Premier, I'm going to be the voice of Dr. Francoeur, who sends you this message 11 minutes ago, said, Mr. Premier, since last Thursday, we have been raising our hands. I personally said 3 times to your health minister, once again, an hour ago, we will be where you need us to be. I am surprised with your words. Is there a lack of communication somewhere? Well, maybe I'm the one who didn't express myself properly, but I did listen the 20 minutes. I heard 20 minutes at Paul Arcand this morning, and what Dr. Francoeur was saying, the president of the specialists union, is that she had been asked to replace family doctors, and perhaps it's me, who didn't express myself properly. But what I wish is that they come and replace nurses. So maybe we just didn't understand one another. It's true that there is no lack of specialists in CHSLDs to do specialist work, but we need specialists with their training to come and help us out to be able to do nursing work. I would like to hear you on another subject, to go back to what Dr. Arruda said yesterday, saying that we were flattening the curve. I imagine that you are speaking and thinking of your deconfinement scenarios. Many European countries have announced theirs. At what time could Quebecers expect to have a similar presentation, on the one hand? And on the other hand, are you going to give a notice? Because, for example, in schooling, people saying that they're going to need a lot of time to put together the necessary mechanisms to, go back, and they want to be able to consult scenarios. So what is the timeline? Right now, we are working with the CNESST, if I remember the name properly, Jean Boulet, for all the standards for companies. So right now, our work in the short term is a lot in businesses. It's too early to start talking about scenarios for schools. We're going to make sure first that the curve is flattened, that we are on the downward aspect of the curve. And once we're there, we'll be able to look at different scenarios. We'll be able to look at how the situation is in the different regions of Quebec. But in the short term, as I said yesterday, we don't plan for schools reopening, but we're working on a scenario to be able to reopen businesses progressively with guidelines to be able to keep the 2-meter distance, for example. Mr. Pilon-Larose, La Presse, on the deaths that you announced today and yesterday, are we still talking about a majority elderly people above 60 or 70 years of age? Could you also break down where these people come from? Hospitals, CHSLDs, their own home? I can take the question, if you'll allow, Mr. Premier. Of course. Yes, it is over 90% of people who are between 70 and above, and there's an 8.4% people from 60 to 69 years of age. Now, as far as where the people come from, or the number of deaths, depending on where they live, 51% lived in CHSLDs before, 21% lived at home, 3.5% were at the hospital, 19.3% in RPAs, residences for the elderly. As far as the deaths, there's a high proportion of people who died in CH, 30%, 19.1% in CHSLDs, but in that there's unknowns as well. You have to understand that the information is not always received, right at the same time. It will be once the file is closed, but there's a proportion of unknown up until now, but it is about the same profile. There are people who are transferred from CHSLDs towards a hospital, especially if they are in what we call a level 1 or 2, where they want to have care. They are transferred, and they may die in hospitals. But in Quebec, it's still a profile that I would tell you is mainly 70 years and above, including some cases between 60 and 69. And the cases, the inferior cases, I think that we're at 3 or 4 only for the time being. But as we were saying, it's not impossible that, when the virus starts circulating again, that maybe some younger people may be hospitalized. But let's hope that they won't die of it. But I mean, any death is important regardless of the age. It's always sad. Mr. Legault, would it be possible to remove a parent who is in a CHSLD that is infected by COVID-19? Because what we're hearing is that if it is possible, the person would lose their spot and would have to go back on a waiting list. Well, it's not ideal, I'm sure, to remove a person because, in fact, that there were waiting lists. So we have to take that into account. And on top of that, usually people who are in CHSLDs are not people who are very autonomous. These are people who need care. So it's hard. When we talked about the possibility of removing people from residences, we're talking about people who were sufficiently autonomous to come to the door alone and be taken into a car by somebody else. So it's a lot more difficult in CHSLDs. What do we do with the sports leagues in the summer? Is it canceled? It's too early to answer this. To help the big festivals, we told them, well, I think it's better that you stop investing money. But as far as, baseball clubs or, youth baseball clubs, it's too early to be able to answer that. Last question. Concerning the 1,000 people that were made available by Ottawa, these are people who are on the side of Health Canada, so they don't concern the Army. Just to confirm, has the federal government offered you 150 military people with medical experience to help out in CHSLDs? Because Mr. Trudeau was asked the question this morning and it wasn't answered clearly. Well, up until a few minutes ago on Twitter, we hadn't had an answer to our question of how many they can send us, how many people from the Army or elsewhere who are qualified and who have experience in health. We hadn't had the answer yet. Before coming in here, just a few minutes before, I saw that number, 1,000, but I'll ask for that to be checked over to see how many they can send us. But I had not yet received the answer before coming here. Thank you. Now a question from a media not represented here, from Sophie Langado from Ricochet, who says, since the beginning of the crisis, no mention has been made in the press conference concerning detention centers. What we hear about saying that there's greater and greater tension and asking for measures and the impossibility of respecting social distancing. Will the Minister of Public Safety is considering letting people who are detained leave, as has been done in other provinces, to reduce the sanitary risk that is very high in those places? I have no information. I know that it was a case in certain provinces, that there was a discussion at the federal level, but it has not been brought to our attention in Quebec, but we'll follow the situation. Thank you. We are now going to go to English questions.
We'll start today with Samuel Pouliot from CTV News.
Hi. Mrs. McCann, can you just repeat in English what you said about the humanitarian effort that's needed and the appeal to specialists to help out?
Yes, what I said is that we have many physicians who go every year for humanitarian missions outside of Quebec in other countries like Africa, but other countries too. And what I'm saying is that this year now, I think the humanitarian mission is here in Quebec in our long-term facilities. And as the Prime Minister said, we need them. We need them to come and help us and help the nurses, help the orderlies, help the whole team in those long-term facilities, that this is the humanitarian mission that we have now in Quebec.
Okay, thank you. And Mr. Legault, criminal background checks are done on employees and managers in seniors' homes in order to protect the seniors. How is that the owner of Heron residence could get licenses to operate multiple long-term care facilities?
Yeah. Okay. First, it's unacceptable for me. If it's really the truth, I've asked my people to check how come we have some background checks for employees, but not for owners taking care of elderly. So I was surprised to hear that. So I've asked them to check and to see if there are other cases.
Cathy Sonnet, CBC News.
Good afternoon. How would you qualify the situation you're going through, Premier Legault, when you practically have to bend your knees to convince physicians and specialists to help out in CHSLDs?
Well, it's a tough situation. Like I explain often, we had some shortages before the crisis. Right now, we have many employees that decided either they are infected or they are scared of going to the CHSLD, so they stay at home. So the shortages are bigger than before. And unfortunately, the main reason for those shortages are because we don't have enough nurses, we don't have enough employees qualified. Why is that? Main reason is because the job is not attractive. We have to review the salary. Mr. Barrett tried to do so in 2015. He said that he was not successful in doing it because it's not easy to, when you negotiate with unions, to have an increase of salary that is different for certain types of employees. So it's not easy, but I want to do that. I said it since a long time that I want to do that, have a better increase for those employees in order that the job be more attractive. And because it's not enough attractive, the people that are with shortages working day to day, the job is tougher because they have to work more because there's not enough staff.
Had to remind physicians and specialists their sense of duty today. You had to go as far as this. How?
Why?
Because
we know we don't have enough nurses in Quebec.
They don't answer the call.
Sorry?
They're not answering your call for help?
Maybe I was not clear enough because what I heard this morning from the two presidents of the two unions, they said there's no lack of doctors in CHSLD. That's not what I'm saying. I know that we have all the doctors to work as doctors, but we need nurses, and they can, with their basic training, they can do most of the job of nurses. So I'm asking them, please, I know that you're overqualified to do this work, but I have no other choices. So I need physicians to come in our residences to help the nurses.
Okay. My last question.
Go ahead.
Thank you. Mr. Arruda, I have a question from one of my colleagues. Families of residents at the Montreal Geriatric Institute and also the unions are saying because of the initial directives for testing, remember, it was people who traveled, those directives blocked them to basically know better the prevalence of the COVID-19, the outbreaks in their own institution. So do you have the impression that the directives were too restrictive in the initial approach in Quebec, and that did contribute to the spread of the COVID-19 in seniors' home?
I think that we must remind the issue of the number of tests that we have at the beginning. The choice we made to go to traveling people, it's because the risk was there. And we had to search and contain that risk. And I think that if we had the test unlimited, we could have tested all Quebecers at the extreme. But I think what introduced more probably the virus into the healthcare, long-term care facilities is probably asymptomatic people or visitors or doctors or nurses that went into that and make this situation. I'm not so sure that I've been testing one time also at the beginning those places that people would have been infected. It takes time before it gets in. So it's a very complex issue, and we always have to adapt it on what we have as a capacity. It's clear we're going to do serologic new things, but remember, at that time, we only had one center being able to do tests, and very fast we went to more than 19, 20 hospitals over that. And we now have the capacity more than other provinces or countries. I think the decision was the right one at that time because we didn't have this capacity that we have right now. And this is dynamics. And, we are looking at the evolution of the situation and decide the priorities always goes on relation to what we look for.
Thank you. The next question is from Raquel Fletcher, Global News. Does the Premier really want doctors to go feed and change people in CHSLDs rather than accept help from the rest of Canada?
Do they want? Sorry.
Rather than accept help from the rest of Canada, if you really want doctors to go feed and change people in CHSLDs?
No, I said that if we can get some help from the Canadian Army with people that have the training to do this work, I will accept this help. But right now, until a few minutes ago, I didn't have this help. They are maybe talking about 1,000. We need 2,000. So I'm asking doctors to come and help work as nurses in our CHSLD in the meantime.
And as a second question, some seniors are complaining that supermarkets and pharmacies are preventing them from entering to purchase essential items. These seniors have no other way to get to the things they need, and some don't have access online. Are stores allowed to bar seniors?
Okay, no. It's unacceptable that we bar seniors. First, it's important to repeat that there's no more risk with senior people to get the COVID-19 than with younger people. The only question is we suggest the seniors to stay at home because they are at risk, so it's for their own good.
Thank you. Next question are from Philote Montreal Gazette for Mr. Legault and Minister McCann. We are hearing about healthcare workers who want to come help in the CHSLDs, but there is no follow-up when they volunteer. What can you do to cut the red tape?
Oh, well, we're really working with everybody, and I want to tell you that in this crisis, there's hardly any red tape. There are some situations that we would like even to go faster. There are some steps to do. But we're working so fast. What we're doing now, we're doing in a couple of days what we used to do in a couple of months. So, no, we want everybody, and we're looking everywhere in all the health workers' domain. And if we haven't seen someone who would like to come in and help us, please let us know, and we will very fast make it that these people will be able to help us.
And as a second and very last question, we are hearing from families who say there are still workers in senior residences who are not being tested for COVID-19 and risk infecting residents. One union, the CSN, says they would like a list of test workers. How can you correct this?
I'm not sure I understood the question. Could you repeat the question?
Yeah, we are hearing from families who say there are still workers in senior residents who are not being tested for COVID-19 and risk infecting residents. So one union, the FSS CSN, says they would like a list of test workers. How can you correct this?
Well, we will certainly contact them. As I want to mention that the head of my cabinet is in contact with all the unions every 2 days. So I will take this preoccupation and will ask that we call them to really understand exactly what the situation is.
So thank you very much. That's all the time we have. Merci tout le monde. Bonne fin de journée.
Thank you. See you all tomorrow.